cancer is now growing in leaps and bounds. And I would not say that cancer wasn't existing in the past. It's only that the detection and investigation has got better now that we tend to see a rising trend in cancer. Having said that, I totally agree with you that our current environmental factors have also contributed to the increased prevalence of cancer. Now, why do I say this? Because as much as we understand that cancer is a disease where you see an abnormality in the growth of any of the body cell lines, whether it's blood, whether it's soft tissue, whether it is brain tissue or any organ damage. But more than that, there are many environmental factors which have led to an increased rise in the prevalence of cancer, namely the lot of pollutants that we see. And these pollutants have a very strong tendency to create a mutation in our genes. And once there's a mutation that has set in, that can lead to any sort of abnormality in the growth of the cells. More than that, our own lifestyle, whether it is about eating a balanced diet, whether it is about having a sedentary job or having a lot of stress, directly or indirectly contribute to evolution or rise of cancer. And that is why it is very important that we put adequate emphasis on the lifestyle that we pursue, follow a healthy routine, and to make sure that we are well educated about cancer and we are able to diagnose it early and be able to treat it completely then. Some of the cancers are where you can really look at very specific signs as early signs of cancers, but in mostly all cancers there are some common signs and symptoms that you could have a look. Let's say if you have sudden loss of weight, which could be amounting to 10% of your body weight happening over a period of 1 month, it could be an early warning sign. I'm not saying that this is only for cancer, but this is one of the common signs that you see in generic all cancers. Then uncontrollable, let's say, bleeding from any organ of your body, or any particular rash, mole, eruption in your body which is suddenly changing its texture, or redness, or any discharge from it. And now going to specific breast cancer. So breast cancer, the early signs that you could detect is through self-breast examination. Now it is very commonly taught to all women, especially in the reproductive age, how they can specifically do self-breast examination, which means that they are able to detect any lump developing in any of the breast, and any abnormal lump in and around the breast or the axillary armpit area. Right to say that people get panicky, because at one point in our life, and even when I was a young med school kid, I know how panicky it would be, because the moment you tell someone that there's cancer in the family, people would believe that you've got a death sentence, which is true, but things have evolved very well now with certain amount of education and intervention at the right time. You could actually treat and sometimes even cure cancer. So what is really needed is to first understand whether it is a cancer or it is some other abnormal growth. That can only be confirmed by a certain amount of specific investigations that need to be done. Once the investigations have confirmed that it is a cancer, it is also important to understand what stage of the cancer it is. The lesser the stage, let's say 1 or 2, it's likely early cancer, which can be easily controlled. If it is an advanced stage of cancer, right from the detection, which means stage 4, that means cancer would have spread to other parts of the body. That is why we call it metastatic cancer. But the point I'm making is, whether it's an early cancer or it is a late stage cancer, the therapies have evolved, the science has evolved, that now we have very specific targeted therapies, immunotherapies available for treating those cancers. So what is needed is to calm down, understand it's a long haul, understand that you will require a lot of not just physical support, but mental support as well. And everyone will work together. The family stands by your side. Have a regular checkup with your physician. Speak to the oncologist. He'll be able to give you a plan and give you specific guidance around how you can manage cancer from its all. Cancer is not a genetic disease. Genetic diseases are very different. Genetic diseases are diseases which you have from the birth. But what we really mean is that there are certain genes in the body that can trigger cancer, which we call proto-oncogenes. Once these proto-oncogenes are hit by a mutation, and when I said mutation, it could be environmental factors, it could be pollutants, which, the mutation does not happen in a day. It happens over a period of time, and then oncogenes are activated. Those people have a tendency to get cancer. And now, like I said, science has evolved to such a level that you can actually identify the genetic pattern of a person. Of course, it's very expensive, so not everybody needs to go and get your genetic testing done. But if you have in your family a history of cancer, either from your maternal side or a paternal side, and knowing that, what sort of cancer is this, you could work with your general physician on a plan to see whether there are certain sort of tests that you can get done to know if you also have got the same gene. And if you know that you've got that same gene in you, that's when you can already start to discuss a plan in terms of how frequently you need to follow up with your doctor, only to make sure that first you may not ever develop cancer. And if by chance you do develop early signs of cancer, you can strike and take required treatment at that point in time, so it doesn't spread from stage 1 to stage 4. So all this, I know I'm probably talking very, very optimist about it, but understand that we are living in a society where people do not even go to the doctor even if there's a basic fever or illness. So what I'm trying to suggest is education, awareness is much more important than actual testing. So be aware that if there are any abnormal signs that your body is throwing at you, you are able to pick those clues fast, and you can go and speak to your doctor, who can guide you very well on how do you need to proceed based on those certain signs and symptoms. Cancers, yes, and those exposures are also of certain specific chemicals. So now that and we are sitting in the heart of Delhi, so that how air pollution is rising in Delhi. So if the air is already so toxic, of course you will see a rising trend of more of lung cancers as well. And especially, you mentioned about artists, there are certain chemicals which are proven to be carcinogenics. And when I say carcinogenics, what I mean is that they have a potential to cause cancer. So avoiding exposure to them or limiting our exposure to them. Cancer is the entire spectrum of any abnormal growth. When I say cancer could be benign, cancer could be metastatic. When I say benign, I mean that it is a very limited growth, which you in common parlance call it tumor. And metastatic is when the cancer has spread from its origin to other organs as well. So the entire spectrum of the disease is called cancer, and under that, if you see a lump, if you feel any localized growth or a benign development, that's what you call tumor. Cancers are varying from blood cancer to brain cancers to lung cancers. You talk about any organ in the body and we have cancer. So not all cancers are preventable, but there's certain research which says that at least for now we know cervical cancer, there are certain vaccines which are available. Having said that, those vaccines will only work for cervical cancer, which is arising out of a particular infection of HPV, human papilloma virus. So cancers which can arise from HPV virus are the cancers that can show some prevention if the vaccine is taken, and that is also important at the appropriate time and age. Because if the exposure to the virus has already happened, cancer vaccine will not work. So it's very important that if there is a merit in the vaccine, it should be taken at the right time before the exposure has happened. curable in certain cases, and cancer is no more a death sentence. Don't panic. Like I said, of course, it means a lot of mental trauma for the family, but know that with right education, right counseling, and early detection and diagnosis can really help curing the cancer also, and in certain cases also, prolong life as well. So you can fight cancer, you can rise against cancer, but the awareness and early detection is the key.